So the general idea, I think, is unless it's necessary, patients should be seen by telemedicine. Is that a fair statement in the future? So this comes to the last part of this discussion. How secure are the platforms that we are using for telemedicine? There's been a lot of discussion about Zoom not being very secure, and there have been changes. I'm not sure how secure the systems are right now. What is your experience?
Certainly within my institution, we've been encouraged to use an NHS-approved platform called Attend Anywhere. So this is actually quite patient-friendly. It sends a text message to the patient who then clicks on the link, and up pops the interface where they can see the clinician. So it can be quite a useful thing. I'm aware of other systems as well, such as Trustedoctor, and I've really only used, my personal experience is really only of those two systems. I personally have not used Microsoft Teams or Zoom for this purpose.
Yeah, and I would echo the NHS party line in that NHS Anywhere is the standard NHS app for video conferencing. The other commercially available software, which had to be used before NHS Anywhere became available, should include, the prerequisite required encryption, which I think now services such as Trustedoctor and Zoom do have. Right.
Okay. So you can imagine it may be difficult to give a serious diagnosis to a newly diagnosed patient with lung cancer via telemedicine. Is it something you are doing, or you prefer still to see patients face to face?
Yes, I think this is a really important thing that we struggled with, I think, during the pandemic. So my personal practice is that I do want to see patients at some point during their diagnostic pathway. And I think that's really important for a number of reasons. One, I think you get a feel for that patient much better face to face, not just their performance status, but actually subtle clues about them and their wishes. I think secondly, they can be introduced to the wider team, the lung cancer nurse specialist, and perhaps, some of the other team members, dietitian, physio, occupational therapist, and enhanced supportive care team as well that we have in our clinics that are now fairly much more empty, so that they have time to talk to our patients in much more detail. So, and then I think it's also quite useful to see them once to sort of start that breaking bad news process, so that you can say to them, actually the CT scan is abnormal. We are worried about it. We're concerned about cancer. We need to do these tests, and we're going to do them urgently, so that when you do have that call in a week or 2 weeks' time with the results, actually it's not brand new information to them. But traditionally, the diagnostic pathway has been face-to-face, and we see people 2 or 3 times during that process. I personally feel it's now appropriate that we see them once, and that can be at any point during that process, and ideally tailored to have an investigation like lung function perhaps at the same time.
Yeah, I would agree. I think that in principle, it's best to see patients face to face. But given the pandemic, it's not about having a choice. So if there's no option for patients to come out or to see them face to face, then technology is what we need to rely on. I personally am very comfortable using it. And I don't think it's so much about doctors being comfortable. I think for me, it's more about patients being comfortable to receive the information via telemedicine. Telemedicine does have advantages as well. The whole team can be on the call. You can see all the members of the team, and you and your relatives from all around the world can be with you. I think it's especially important to have a relative with you in person, but also on the teleconference call, you can have relatives joining you from anywhere.